With the introduction of iVAS, Stryker is your single source for vertebral compression fracture solutions, no matter if you're performing percutaneous vertebroplasty or vertebral augmentation. iVAS is a complete system for performing vertebral augmentation procedures. The kit consists of a balloon catheter, an access cannula, a locking syringe, and an inflator. Supplementary products are also available. Do not use if vertebral height is compromised more than 68% or if there is instability of the posterior wall and/or pedicles. During a vertebral augmentation, a balloon catheter is used to create a void in a fractured vertebra, helping to allow for contained and controlled cement delivery. This can be accomplished by utilizing either a unipedicular or bipedicular approach. If performing bipedicularly, repeat each of the following steps on both sides of the vertebra. To begin a vertebral augmentation procedure using iVAS, first prepare the inflator. Unlock the inflator handle, pull the handle back, and fill the inflator with contrast. Now connect the stopcock and open. Then, holding the inflator in an upright position, push the handle to purge air from the inflator. When all the air bubbles have been eliminated, close the stopcock and lock the inflator handle. Next, under fluoroscopic guidance, insert and advance the access cannula into the cortical bone of the vertebral body. Once the cannula has reached the desired position, unlock and remove the stylet. While rotating, insert the Stryker hand drill into the access cannula. Once you have established an adequate pathway, remove the hand drill by continuing to rotate clockwise while retracting. Next, insert a deflated balloon catheter through the access cannula and into the pathway you've just created. Under fluoroscopic guidance, move the balloon catheter into the desired location for balloon inflation. Radiopaque markers provide accurate visualization of the balloon's distal and proximal boundaries to aid in placement. Once the iVAS balloon catheter is properly positioned, connect it to the stopcock on the prepared inflator. Insert the locking syringe into the side port of the stopcock, confirming that its handle is turned towards the inflator to ensure an open path. Next, pull the plunger on the locking syringe to reduce air from the balloon catheter. Turn the stopcock handle to open a path between the balloon catheter and the inflator, and then disconnect the locking syringe. Unlock the inflator to allow the handle to move forward until the pressure equalizes. Then, re-lock the inflator handle. Paying close attention to the fluoroscopic images, pressure gauge, and volume of contrast, slowly turn the inflator handle to inflate the balloon with contrast. Slow inflation of the balloon allows time for it to expand and compact bone while limiting the pressure within the balloon. When the balloon catheter is inflated to desired size, pressure, and/or volume, unlock the inflator handle and pull it back to deflate and remove the balloon. A void has now been created for the injection of bone cement. If using a bipedicular approach, please ensure all previous steps are completed on both sides before proceeding. After deflating and removing the balloon, insert the Vertiport cement cannula through the access needle. Slowly inject Vertiplex HV high viscosity bone cement while carefully monitoring the fluoroscopic imaging. For those with known allergies to bone cement, do not use this system. The hardened cement creates an internal cast that stabilizes the fracture. Clinical results for vertebral augmentation show the potential for substantial pain relief, increased mobility, and improved quality of life. If you have infection, severe bleeding, or are pregnant, this procedure is not for you. Once an adequate fill has been achieved, remove the Vertiport from the access needle and replace the original access stylet. Slowly remove the access needle to complete the procedure. Vertebral augmentation with the Stryker iVAS system is a minimally invasive procedure for treating vertebral compression fractures. From iVAS to our mixer and delivery systems, cements, and needles, every product in Stryker's unprecedented VCF portfolio is designed to work seamlessly together. Stryker Interventional Spine, your single source for VCF solutions.